Hi guys, welcome and welcome back to my channel. Today I'll be talking about 12 critical signs every pregnant woman should never ignore. So whether you're pregnant or you know somebody who is, this information could save lives. So watch till the very end. Pregnancy is a beautiful journey, but it comes with risk. Some signs might seem normal, but they can signal serious health issues. So it is better you learn how to act quickly wherever there is need for it so as to ensure a successful pregnancy journey. But before I dive into anything, I want to urge all pregnant women to please make sure that any hospital they register for antenatal care should be where that is very accessible to them. Because I've learned from different pregnant women that the reason why they are being restricted from coming to lay a complaint is because the house is too far from where they registered. So they couldn't come as quick as possible. This shouldn't be. Okay, let's say for instance, you may not have a hospital around where you live, but whenever you register, make sure you have an access to it. Either you have a bike man that can be taking you there, or you have a car, or you have somebody that you can just call immediately so that they can take you there. Please, no restrictions, no restrictions. All right, let's dive into today's topic. Mind you, this video is not about scaring you, it is about sensitizing you to what you need to know and put in check so as to ensure your safety and that of your baby. The first sign you need to watch out for is severe abdominal pain. First of all, as a pregnant woman, there should be no pain. You shouldn't even feel any abdominal pain because it can be a sign of miscarriage or even preeclampsia. You never can tell. So always consult your doctor if you feel some kind of strange abdominal pain that is severe. Please reach out. 2. Vaginal bleeding or spotting. During your early pregnancy, like the first trimester, spotting is usually common, but not everyone. The moment you start seeing an heavy flow, heavy bleeding, don't wait. Go to the hospital ASAP because this could be miscarriage or separation of placenta, like placenta complications. So you never can tell. Reach out. 3. If you are experiencing severe headaches, like the headache that you use medicine, it go and come back, like it just continue to persist, or you have swelling all over your body, or you're having blood vision, you can't see clearly. All these symptoms can be as a result of high blood pressure. See a doctor straight away to get your blood pressure checked because these symptoms can be a sign of preeclampsia. That is when there's excess protein in your urine and there's persistent high blood pressure. So if you don't quickly detect it, if you are the kind of person that when you see a symptom, something changing in your body, you carry highs. Instead of you to do something about it, get to see your doctor, you carry highs. So if undetected, it can lead to eclampsia. And when eclampsia occurs, the mother will start throwing fits. There can be liver damage, heart damage, all these important organs can damage, affecting the mother and the baby. 4. If you're having high fever, like high body temperature, this could be a sign of infection and it can lead to premature labor. So in some cases, you can take paracetamol to reduce the temperature, but do not take ibuprofen, aspirin, all these NSAIDs. So it is better you see your doctor also so that they can tell you the right thing to do. 5. Severe vomiting. If you're vomiting non-stop, this can affect the mother and the baby because it can lead to dehydration and serious electrolyte imbalance. 6. Painful urination. If you are feeling pain while you urinate, this could be as a result of urinary tract infection. On a normal ground, a pregnant woman usually urinates frequently, right? And this is because the womb, the uterus, is pressing on the bladder. If you're experiencing pain while urinating, see your doctor straight away. 7. Reduce fetal movement. On a normal ground, during 20 weeks of pregnancy, if it is first pregnancy, you start noticing baby movement. But if it is your later pregnancy or your subsequent pregnancy, you start noticing this movement by 18th weeks. But pregnancy is different though. So you have to start being conversant with these kicks. Like you can start by third trimester, maybe 5 to 10 days. Try to monitor the movement of your baby. Like do that just to know how things go. 10 movements in every 2 hours is considered normal. So try to know this, and the moment you notice a decrease in movement, a reduced movement from what is normal, see your doctor ASAP. 8. By third trimester, most pregnant women usually complain of shortness of breath, difficulty in breathing, and this is because the growing uterus is pushing up the diaphragm and this thereby compresses the lung. But if you're noticing that this thing is pressing up your chest, you couldn't breathe well, please see a doctor because it could be a sign of worsening asthma, pulmonary embolism, that is blood clots in your chest, hypertension. It could be a sign of pneumonia. You never can tell. To see your doctor. Now, is severe itching. As a pregnant woman, it is normal for you to itch at times because your skin around your stomach is stretching so that it can allow more room for your baby to grow well. Or if you are noticing a severe itching, especially on the palms of your hand and the sole of your feet, you need to go and see a doctor because this can be as a result of a condition called intrahepatic cholestasis of pregnancy. This condition results when there is deposition or buildup of bile acid in your body. This is revealed through your skin, leading to severe itching, and this can lead to premature labor, fetal growth retardation. It can cause baby pooping inside and at most cause fetal death. So all these things should not be overlooked and say it's normal to be itching. Don't see anything, any changes as normal until your doctor confirms it. 10. A watery vaginal discharge. If you experience that you have this flood of water rush down your legs and you know that this thing is not urine, but to confirm, you can go to the toilet and go and urinate. After you urinate and you see that this water is still full, it's still continue. This could be that your water bag has broken and you need to get to the hospital ASAP. 11. Sudden weight gain. While weight gain is normal during pregnancy, but if it is sudden, if it is rapid, like you don't understand why you gain so much weight during a short period of time, then you need to go and see the doctor because a lot of changes might be happening. Also, do watch your weight. Whenever you go for antenatal visit, you can inquire from your doctor the normal weight you're supposed to maintain during any phase of your pregnancy so that you will use this to monitor yourself. And finally, a foul, smelly vaginal discharge. Vaginal discharge usually increases during pregnancy. This is the normal thing due to hormones, but this should just be clear and mucoid. But the moment you notice a foul, smelly, greenish, or this yellowish discharge, especially if it's cloudy white and even have a blood stain, this can be as a result of vaginal infection and should be treated as soon as possible. Remember that vaginal infection can cause premature labor. So if you notice any of these symptoms, don't panic, don't be worried, and don't ignore either. It's better you see your healthcare provider and get the right care as soon as possible. It is always better to be safe than sorry, right? Now, before you go, do you know that during pregnancy there are some medicines that you need to avoid and not take so as to ensure your baby's health and your own health? Check this video out where I explain 11 common medicines you should absolutely avoid in order to keep your little one safe. I hope I get to see you in the next video. Bye.